welcome to Wiston Hospital's maternity unit. Thank you for choosing us for providing your care in your pregnancy, delivery and postnatal period. We hope your pregnancy and birth will be a happy one, and we look forward to sharing this wonderful experience with you.
Our vision is to enable women's dreams and wishes for their pregnancy and birth to be realised. We aim to offer personalised care in a friendly, supportive and safe environment for women, their partners, babies and their families. Our team of experts include midwives, healthcare assistants, maternity support workers, obstetricians, sonographers, paediatricians, neonatal nurses and other professionals and support staff who all work together to deliver an excellent, safe and high-quality service. We will support our women in their choice of where to have their baby, either in the hospital or at home. Here is a brief introduction to the services we provide.
Hello, welcome to Women's Outpatient Department. This is where you'll receive your antenatal care.
Antenatal care is the term used to describe the care we provide to you during your pregnancy. Although we aim for midwifery-led care, we also provide a range of specialist multidisciplinary clinics for women whose pregnancies may be complicated by other medical conditions such as diabetes. We offer antenatal screening and provide advice to all women who book with us. Our aim is to work in partnership with you and your family to ensure joint decision-making surrounding your care. During your pregnancy, you will have antenatal care in the community setting provided by our community midwifery team unless you are classed as high risk. Then your antenatal care may be provided at the hospital.
Welcome to our Fetal Maternal Assessment Unit.
The Fetal Maternal Assessment Unit is a relaxing and informal environment created for mothers requiring monitoring of at-risk pregnancies or further investigations in their pregnancy on an outpatient basis. The unit operates an appointment system and is open to referrals from GPs, community midwives and patients who are already under the care of the unit.
This is our delivery suite where you will give birth to your baby.
Delivery suite is where you will be admitted when you are in labour, if you have chosen to give birth in hospital or you're admitted as an emergency. If you believe that you are in labour or your waters have broken, then please contact Delivery Suite before you travel to the hospital. All contact details for the unit are in your maternity information pack. Our delivery suite has 14 fully equipped rooms, including 2 birthing pools and a midwife-led delivery room. Women and their baby can go home from the delivery suite if clinically well and following a minimum 6-hour stay. Otherwise, you'll be cared for on Ward 2E. The majority of women who have vaginal births can go home within 24 hours of birth when their care is transferred to the community midwifery team.
We have a dedicated theatre team attached to delivery suite.
Should you elect to have a caesarean section, or should our medical staff advise you this is the safest option for you and your baby, you will give birth in our dedicated delivery theatre. The theatre may also be used if medical staff need to provide extra assistance to you during a vaginal birth. Following birth, you and your baby will then be transferred back to delivery suite or straight to the postnatal ward.
Hello and welcome to Ward 2E.
You will stay on Ward 2E if you need overnight monitoring or investigations before you give birth and following delivery, if your midwife or medical staff advise that it's necessary. Where possible, women who require monitoring before birth will stay in a separate area to those who have already delivered their baby. This is to ensure that your rest is not disrupted during the night. If you need an overnight stay with us following birth, you will stay in one of our 4 bedded bays or in your own single room. Priority for single rooms is given to women or their baby who have a medical requirement. Partners can stay overnight if a side room is available and you are clinically well. Otherwise, we have extended visiting hours to ensure parents can enjoy valuable time with their family.
We also have a dedicated community midwifery team.
The community midwifery team provide both antenatal and postnatal care. You will visit your community midwife throughout your pregnancy, at your GP surgery or in your local children's centre. They will monitor your progress throughout, and should they have any concerns about the development of your baby or your own health, they will refer you to the hospital service for monitoring. The community midwives are also on call 24 hours a day for those women who choose to have a home birth. You will receive 2 home visits from your community midwife after the birth of your baby to check your health and your baby's progress. Your care will then be taken over by the community health visitor.
Welcome to a special place for special babies.
Our special care baby unit looks after babies who require some form of treatment or a high level of observation following birth. This could be for babies born prematurely or unwell who require either special care, high dependency or short-term intensive care. Babies who need long-term intensive care are transferred to the nearest hospital with these facilities. In the special care baby unit, our specially trained neonatal nurses will look after your baby along with the expert medical team to optimise your baby's care.
Our dedicated team of midwives are on hand to help you with any questions you may have about being a parent and looking after your little one.
We provide a range of specialist midwifery and community services, including parentcraft, young parent clinics, substance misuse, perinatal mental health, hypnobirthing, smoking cessation support, aquanatal, home birth support groups, and physiotherapy services. Our infant feeding team are on hand to support you in your choice of feeding. We provide weekly infant feeding drop-in sessions at the hospital, and the team phone all women on discharge to offer support with their chosen feeding method. We are here to help answer any queries you may have in order to make an informed choice on how to feed your baby. Our programme of parent craft sessions have been designed to help you and your partner through pregnancy and beyond. The sessions cover pregnancy, labour, pain relief and coping mechanisms, relaxation, care of your baby, breastfeeding and postnatal care. These sessions are held across St Helens and Knowsley, and your midwife will be able to provide further information.
We also have a team of supervisors of midwives based at Wiston Hospital.
A supervisor of midwives is responsible for helping to ensure protection of you, your baby and family. We are also available to give advice, guidance and support with your birth choices and experience. If you wish to speak to a supervisor at midwives, there is someone available 24 hours a day.
If you choose to give birth in hospital, we will invite you and your partner to take a tour of our facilities so that you can become familiar with the surroundings. Whether you choose to give birth at home or here in our fantastic maternity unit, we look forward to meeting you and your family.